Hello everyone, my name is Carlos Fajardo, and this is a presentation of my research titled Miniaturized Electrochemical Immunosensor for non-small cell lung cancer biomarker detection as part of the 32nd International Materials Research Congress. So let's start. As we know, cancer is a disease that concerns the population globally. Lung cancer is ranked first in both incidence and mortality, and non-small cell lung cancer covers around 85% of all cases, with a 5-year survival rate of only 28%. This is mainly because most cases are detected in advanced stages, where treatment has no longer a curative intention, and this can be attributed to the current screening and diagnostic methods. The screening guidelines recommend yearly low-dose CT scans for people at high risk, which have low sensitivity and specificity, since they cannot detect all types of lung cancer, and those found are not always in the early stages. And the actual way of diagnosing the disease is by observing a lung cell sample, which is obtained by invasive and complicated methods, and analyzing it by genomic or molecular testing, which can limit the accessibility of a diagnosis. Therefore, we can observe a need for a widely available, accessible, non-invasive, safe, and sensitive non-small cell lung cancer detection technique that allows us to diagnose the disease in the early stages, which can potentially increase patient survival rates and their probability of a curative intended treatment. So cancer biomarkers are biomolecules produced by cancer or normal cells in response to cancerous or non-cancerous conditions that gives us cancer information. They can be used for many things, including screening and diagnosis. And among all types of biomarkers, circulating tumor proteins can be found in blood and serum samples that can be easily obtained, making them very useful in the clinical environment. So CYFRA 21-1 is one of the most reliable, specific, and selective biomarkers for non-small cell lung cancer, and its serum concentration is highly related to the stage of the disease. CYFRA is a fragment of cytokeratin 19, which is a protein that composes the intermediate filaments of the respiratory epithelium cells that give mechanical strength to the cells. And it is cleaved by caspases when cells undergo neoplastic transformation, releasing this soluble fragment to the serum, thus being an indicator of the neoplastic load. This fragment has two specific epitopes that antibodies can recognize. However, its concentration is very low, making it difficult to detect. Electrochemical immunosensing is one of the most studied and used techniques for detecting biomarkers. It is based on the measurement of an electrical signal produced by a chemical reaction, which is triggered by an electric input, and thus is related to the concentration of the analyte of interest. This technique can be miniaturized by using screen-printed electrodes. They are widely available and allow us for a simple and inexpensive detection with high reproducibility and sensitivity in a minimal use of reagents. One of the most important parts of the detection is the immobilization of the capture antibody over the transducing platform, which in this case is the working electrode of the screen-printed electrode. And a gold carbon binding approach for antibody immobilization has shown a high conductance and stability in a simple electron transfer mechanism, increasing the sensitivity of the developed sensor. So we developed an electrochemical immunosensor using gold nanoparticle screen-printed electrodes and a gold carbon binding approach for antibody immobilization. The gold carbon bridge was achieved using TeV by removing the trimethyl group in a reaction catalyzed by TBAF. So the amine groups of the capture antibody attach to the carboxylic groups after their activation by DCNHs, creating an amide bond. Then BSA is used to block the remaining active and non-specific binding sites so that CYFRA can be recognized by the capture antibody and the detection antibody, which will generate a signal by differential pulse voltammetry that we can then relate to the protein concentration. To understand the process, we first characterize the sensor. Electrochemical impedance spectroscopy, or EIS, gives us sensitive information about surface modifications, and we design an equivalent circuit model with an accuracy of more than 95% to describe the charge transfer resistance of the sensor, which was further compared to cyclic voltammetry, or CV scan. We observed a minimal charge transfer resistance after the electrode-electrode polish, since there was no organic coating, and it increased after the TEV addition because the organic component hindered the electron transfer. Resistance increased after the carboxyl group's activation due to partial elimination of the electrostatic repulsion, and after each biomolecule was added, such as the capture antibody, CIFRA, and the detection antibody, the resistance increased because of the electron transfer interference. Conversely, the opposite happens in the CV scans following Ohm's law. Scanning electron microscopy and atomic force microscopy were used to identify the morphology of the gold particles and observe the surface modifications over the working electrode. The nature of these modifications was assessed by ADX, where an increase in the carbon mass was observed after functionalization, confirming the organic nature of the coating. Finally, the Immunosensor performance was analyzed by differential pulse voltammetry in 4 consecutive concentration ranges of CIFRA. We obtained linear regression models for each range, which allowed us to accurately predict the CIFRA concentration. A limit of detection of 7.5 times 10 to the minus 10 nanograms per ml was achieved, being the lowest LOD reported for any CIFRA detection technology. The sensitivity of the sensor was tested by subjecting it to potential interferences such as BSA and to another antibody, and comparing the response to that for CIFRA detection, obtaining a current change of less than 22% of that of CIFRA. And for the stability test, the sensor was stored for 1 and 2 weeks, and the current was compared to the initial one, obtaining a change of less than 11% after 2 weeks of storage. To evaluate the sensor viability in a clinical environment, it was tested under 3 different circumstances. First, it was tested by adding a known concentration of CIFRA to fetal bovine serum because of its natural lack of CIFRA. Then we tested with serial dilution of human serum with no added CIFRA. And after that, we spiked a known concentration of CIFRA in diluted human serum. We evaluated the sensor's performance in these 3 scenarios, and again, achieving highly linear behaviors and accurate models for CIFRA concentration prediction. To conclude, in this work, we developed a miniaturized electrochemical immunosensor for the detection of the non-small cell lung cancer biomarker CIFRA 211, which presented ultra-high sensitivity, a linear behavior over a wide working range, including the cutoff value, high selectivity, and good performance under complex media such as human serum, which is a real sample of interest, besides providing an accurate electric circuit model of the sensor and a morphological and chemical characterization to support the functionalization process. So that's it. Thank you for your attention, and don't hesitate to contact me. Thank you.